Hello again from Washington, D.C. This is Peter Thomas, General Counsel of NAAOP, the National Association for the Advancement of Orthotics and Prosthetics. Three major issues to talk about this month. First, the House and Senate are poised to pass a Veterans Administration bill, and the President is expected to sign that legislation that would do a number of things. But one of the key elements of the legislation is actually a provision that the NAAOP has been fighting for some time, and that is included in the Injured and Amputee Veterans Bill of Rights, H.R. 3408. It would be a stretch to say that the Injured and Amputee Veteran Bill of Rights passed and was included in the VA bill. That's not the case. But one of the key elements of that bill has been included in a similar form to the way that it's included in the VA Bill of Rights. It involves the issue of private contracting with providers outside of the VA. It's a much broader provision than the VA Bill of Rights included, but it does impact orthotics and prosthetics. So we wanted to make sure that you were well aware of it. The pending bill would ultimately permit veterans who either live more than 40 miles away from a VA facility, in this case orthotic and prosthetic facility, or have been waiting for more than 30 days for an appointment to see an orthotist prosthetist to receive care, would be permitted to go outside of the VA system and obtain care from private practitioners. Now, this doesn't just apply to O&P. This applies to physicians and hospitals and all other kinds of providers. There's a few caveats. The providers have to be enrolled and participating in the Medicare program in order to see these veteran patients, and the VA will pay Medicare rates. As long as practitioners maintain their licenses and credentials that they otherwise would need in order to qualify for the Medicare program, they'll be permitted to be within the set of providers who can serve veterans. So how this new provision overlays and interacts with the existing set of contracts that the VA has with private practitioners is not yet known. As most people know, more than 80% of veterans' orthotic and prosthetic care is provided by private practitioners through contracts with the VA. This is another way that veterans can get access to private practitioners. And so in the coming weeks and months, we'll be meeting with the VA, we will be working with our alliance partners, and we'll be trying to figure out and provide to you more information of exactly how you can serve these veteran beneficiaries, these veteran patients. But suffice to say that we're very pleased that this provision was included in the Veterans Bill. We worked hard to try to move forward the VA Bill of Rights, and we have not yet given up. We certainly will continue to push to try to get as many of the rights listed in that legislation included in future VA legislation, and perhaps going directly to the new Secretary of the VA, who was approved very recently by a unanimous vote in the Senate, and trying to get the VA to implement the VA Bill of Rights on its own authority. Next issue I wanted to bring to people's attention is prior authorization. The NAAOP, along with its alliance partners, submitted very extensive comments. Those comments can be found on the NAAOP website, NAAOP.org, and ultimately we distributed comments for our own members to submit as well. The prior authorization comments we submitted, I think, strike a nice balance between essentially questioning whether prior authorization is a good fit for the O&P field, especially the types of services that O&P practitioners provide, and making very specific recommendations to improve the prior authorization process should CMS decide to move forward in applying it to O&P, at least to some degree or some portion of orthotic and prosthetic care. And so those caveats and those recommendations can be found in our statement, and we encourage you to visit the website and examine those comments yourself. And finally, off-the-shelf orthotics. There's a new regulation that's proposed. It's a proposed rule. The comments are due on September 2nd, and that would seek to define further the issue of off-the-shelf orthotics and who can provide or who is qualified and considered someone that provides OTS orthotics. The previous rulemaking, they essentially said that off-the-shelf orthotics are those that require minimal self-adjustment by the beneficiary, the caretaker, or a supplier who is not a certified orthotist, and they reference ABC and DOC. And then they also reference and other individuals with expertise in orthotics, with specialty training, essentially is the words they use. This regulation examines that word, specialty training, and it basically tries to define exactly what that means. We will be submitting extensive comments because it has all kinds of implications on the provision of orthotics by a variety of different practitioners and providers. We welcome your comments to our agenda, how we've been doing. We also welcome you onto the website to try to submit comments yourself to the OTS rule, again, which are due in the beginning of September. Thanks so much. Have a great August.